Well, the possibility that the return of influenza could hit when COVID cases surge again has health officials concerned and using very cautious language. Our Penny Daflos is here with that. Penny, the tone of today's news conference was not really optimistic about the fall and the winter. And of course, that's when respiratory viruses really hit hard.
Exactly. There was also a technical briefing earlier today for reporters before the public news conference. It was a very similar tone, cautious, worried, and unsure if we're going to be facing a double whammy of cold and the flu. The biggest fear is what happens if they both hit hard when our health system may not be able to handle it, given a resurgence of the flu in the southern hemisphere and the possibility of new COVID variants emerging. Dr. Bonnie Henry says we can't let our guard down. There is an expectation that November in particular could see a surge in both illnesses, which is troubling considering how much strain our health system has already been in the summer when respiratory viruses are usually at their lowest. I asked how bad things would have to get in terms of COVID deaths or hospitalizations before government considers reviving public health measures. Here's what Dr. Henry said.
Transmission in the community, outbreaks, who's getting sick, who's getting hospitalized, the impact on healthcare workers and the system, the tools that we used when we had no immunity and where we needed to take drastic measures to slow down the spread of the virus are no longer, in some cases, effective and are no longer needed for the most part.
Henry described mask or vaccine mandates as a last resort, but not totally out of the question. That being said, she's really watching to see if we get any of those new COVID variants everyone's worried about, especially ones that could essentially dodge around vaccines and make people very sick again. So mandates not off the table, but things would really have to take a turn for the worse before they go down that road again.
So, Penny, of course, we all want to move on from the pandemic and these orders, so it sounds like the province is really doubling down on personal health measures like choosing to mask or staying at home when you're sick rather than public health orders.
Yeah, that's right. And very much so because government really wants to get back to normal. But the problem is that's really hard for people who have been and continue to remain high risk. An interesting note today, Henry talked about the importance of good indoor ventilation as playing a role in preventing the spread of COVID or the flu, which many experts have been emphasizing for quite some time, hasn't been a big talking point here.
Okay, thank you, Penny.